Hello, I'm a recreation therapy student from the University of Lethbridge, here to talk about multiple sclerosis. At the end of this video, you will have a better understanding of what multiple sclerosis is, symptoms that you may see, how therapeutic riding helps, and how best to assist the riders with the diagnosis of multiple sclerosis for their success. What is multiple sclerosis, also known as MS? It is an unpredictable autoimmune disease of the central nervous system that disrupts the flow of information within the brain and/or between the body and brain. Nerve fibers called myelin are damaged in multiple areas, producing a variety of symptoms. Scar tissue called lesions or sclerosis form over the nerve fibers. Most people are diagnosed between the ages of 20 and 50. The disease affects more women than men at a rate of 3 to 1. It is a progressive disease. People may also be subjected to flare-ups that may or may not improve. Life expectancy for someone with MS is only 7 years less than the general population. Currently, the cause of MS is unknown, diagnosis is difficult, and there is no cure. But there are a variety of medications which are helpful. Symptoms of MS. The progression, severity, and specific symptoms of MS in any one person cannot yet be predicted, and they differ from person to person. Symptoms may flare up and then disappear, or they can persist and worsen over time. The most common symptoms of MS are the MS hug, which feels like a squeezing sensation around the torso. Fatigue, it can be extreme and affects ability to perform activities of daily living. Walking difficulties, gait, balance, weakness. Numbness or tingling is often a first symptom experienced. Spasticity is a feeling of stiffness and involuntary muscle spasms. This usually happens in the legs. Weakness due to a less physically active lifestyle due to the fatigue. Vision problems, another early symptom. Your vision can be blurred, poor contrast, or pain on eye movement. Vertigo and dizziness, the sensation of lightheadedness and spinning. Bladder and bowel problems, and these can be managed with medicines, diet, and physical activity. Pain and itching. Half of people with MS have chronic or significant pain. Cognitive changes, difficulty processing and organizing information, including problem solving. Speech difficulties in finding words and speaking. Emotional changes can be anxiety, mood swings, irritability, or laughing fits. Clinical depression is one of the most common symptoms. How therapeutic riding helps. Exercise is key for overall health for all of us. Riding horses stimulate the muscles in your body. The gait of the horse is similar to the gait a person has when walking. There are many benefits physically, emotionally, socially, and cognitively. Physically, your core muscles are targeted and strengthened. Flexibility, posture, and coordination are increased. These are helpful to decrease fall risks. Emotionally, there is a wonderful connection between animals and people, even though horses are huge and not everyone is comfortable right away. The horses for therapeutic riding are selected with their nature in mind. The clients connect with horses in amazing ways. Socially, due to extreme fatigue, many people with MS have their social relationships decreased due to being unable to have the energy to make time for socializing. Cognitively, lifelong learning is good for the brain. Learning to ride and stay focused is a wonderful brain exercise. Coming out to exercise with the horses allows opportunities to visit with other clients, staff, and volunteers. The client is able to socialize, have some physical exercise, meet some emotional and cognitive needs, and this goes a long way towards improving the quality of life for a person. Ways to help a client with MS. To note, most symptoms of MS are physical. A person's cognition may not be affected early on. Day-to-day symptoms may differ, so be encouraging on those off days. Fatigue is a significant factor in one's abilities. Watch the video on the spoon theory to learn more about how activities of daily living deplete one's energy resources each day. Be alert for balance and dizziness, both on and off the horse. Be aware of heat sensitivity. If it is a hot day, or the person gets overheated by the exercise, they may mention blurred vision, and the MS symptoms may worsen. They will need to rest in a cool spot with cold fluids and possibly ice packs. Alternatively, on a cold day, spasticity symptoms may worsen. They may stiffen up, or movements may become jerky. Reminders to support the client to help keep a safe environment, and be kind, gentle, encouraging, and praise the client for their efforts. Help them feel special. Here is a list of resources used to make this video. Most are also noted on the information sheet regarding multiple sclerosis, where you can access the Spoon Theory video. On behalf of the Lethbridge Therapeutic Riding Association, thank you for joining the volunteer program, and best wishes.